Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saracedo is interpreting the press conference in Spanish. His interpretation will be available on the county's website and YouTube page shortly after we conclude the press conference. For weeks, we have been consistently warning about the likelihood that another COVID-19 surge in cases could soon hit California. Unfortunately, the wave has now hit. COVID-19 cases are increasing dramatically around the state. Hospitalizations are also increasing, and unfortunately, increasing deaths will likely follow. Ventura County has reported 412 new cases today, and San Luis Obispo, a county half our size, reported 121 new cases. Santa Barbara County has reported 74 new cases today. The California Department of Public Health is taking steps to slow the spread of the virus by using the emergency brake in the Blueprint for a Safer Economy. Santa Barbara County was accelerated by the state into the purple tier, along with 40 other counties in California this past Tuesday. Yesterday, the State Department of Public Health imposed a limited stay-at-home order between the hours of 10 p.m. and 5 a.m. in California counties that are in the purple tier. Everyone in those counties is requested to stay at home as much as possible during those hours, and non-essential businesses must close. This action is being taken now because limiting risk of exposure is critical. Activities conducted later in the evening are more likely to include social gatherings with reduced inhibitions and less compliance with preventative measures. New statewide guidance on masks has now been expanded to request that everyone in the state of California wear masks when they are outdoors and could come in contact with another person. Instead of traditional large family gatherings, many people are planning new ways to celebrate Thanksgiving this year. Former Santa Barbara Mayor Sheila Lodge shared with me in an email how she plans to celebrate Thanksgiving with her family next week. Mrs. Lodge explained that she's one of 18 cousins who for the last 12 years have gotten together at a cousin's home in San Luis Obispo for Thanksgiving dinner. This year, they're going to have a Zoom gathering before they each have their own actual dinners. Everyone will have a chance to catch up with each other one at a time. She said, in a way, it'll be better than when we sit around in the living room chatting, because that often ends up in separate conversations. There'll be no driving, and cousins who live in Arizona will be able to participate when ordinarily it's too far for them to join us. Thank you, Mayor Lodge, for sharing your family's new COVID-safe Thanksgiving tradition and for doing your part to help stop the spread of the virus at this critical moment. Thanksgiving is also an opportunity to help our neighbors who are less fortunate. Food Bank of Santa Barbara County operates countywide, serving local residents who need food assistance. Food Bank is seeking 4,000 turkeys this year, either fresh or frozen, to distribute to families during the holidays who can't afford them. Anyone who'd like to help can drop off birds at the Food Bank's warehouses Monday through Friday in Santa Barbara at 4554 Hollister Avenue from 8 a.m. to 3 p.m. and in Santa Maria at 490 West Foster Road from 7:15 a.m. to 3 p.m. Turkeys or chickens must be dropped off by November 23rd to ensure that delivery to families will be in time for Thanksgiving, but the Food Bank will also accept donations through December 11th for other holiday meals. Paul Wilkins, Food Bank Chief Operations Officer, said, with shortages expected for food banks across the country in the last quarter of the year, and when our community is facing rampant job losses and economic crisis, the need is higher than ever this year. If you'd like to help but are uncomfortable dropping off a turkey or chicken in person, you can sponsor holiday meals online by visiting foodbanksbc.org. Community members or local businesses who'd like to host a turkey drive may also call 805-319-9096. The Good Samaritan shelters in Lompoc and Santa Maria are focusing on sheltering in place and keeping their clients safe within their programs during the holidays. They're hoping to provide a full Thanksgiving dinner for every program and provide residents with the ability to teleconnect via Zoom with their loved ones. If you'd like to help support Good Sam's great work, please visit their website at goodsamaritanshelter.org. Finally, I'd like to personally thank all our community's healthcare workers, first responders, and essential workers for working through the holidays. Healthcare workers have not had a break since the pandemic began. The initial COVID-19 patient surge was immediately followed by a surge in treating patients that had previously deferred medical appointments. As new COVID-19 cases begin to surge again, there will be no holiday break for the exhausted healthcare community. Our first responders never get a break during the holidays. Their responsibility to keep us safe doesn't stop. Emergencies and disasters keep occurring with increasing frequency and scope, and this year is no exception. Fires have ignited around the county, rescue operations have been mounted, and law enforcement officers continue to bravely step in front of public safety threats when they occur. The unsung heroes of the pandemic have been essential workers. These jobs can't be done from home. Essential workers must continue to show up for work knowing they are especially exposed to the virus. My personal thanks goes out to the healthcare workers, first responders, and essential workers who are caring for our sick neighbors, keeping a watchful eye out for safety, and keeping our economy going at this very difficult time. I hope you know how much each of us appreciate your sacrifice, dedication, and commitment to our community. I'd now like to introduce Dr. Renoso, the County Public Health Director.
Thank you, Supervisor Hart. A lot has happened since our press conference last Friday. As you are aware, we are facing another rapid increase in COVID-19 cases. And as a result of our increases in cases, we were assigned to the purple tier on Monday with a 7.1 adjusted case rate. And our case rates continue to increase. Our estimated average case rate for November 11th through the 16th is now 9.7. We are seeing increases in new cases in all areas of our county, unfortunately. I invite you to visit our new community dashboard at publichealthsbc.org for detailed information. The state health officer order for limited stay at home for purple tier counties will take effect tomorrow, Saturday, November 21st at 10 p.m. and will be in effect till December 21st, 2020, and may be extended or revised as needed. Essentially, this state public health order prohibits non-essential work and gatherings between the hours of 10 p.m. and 5 a.m. every day. Non-essential businesses must close between 10 p.m. and 5 a.m., but restaurants may continue to offer takeout food and delivery past 10 p.m. It is not a curfew for individuals or members of the same household, but instead applies only to gatherings or activities with members of other households. People from the same household may engage in activities outside the home between 10 p.m. and 5 a.m., such as retrieve takeout food, walk the dog, and exercise, so long as they are not interacting with members from other households. And the order will be enforced locally and by state entities. As cases continue to increase rapidly across the U.S., we need to do Thanksgiving and other upcoming holidays differently this year. Gatherings during the holidays are traditionally an opportunity to reconnect with family and friends. But this holiday season, it is absolutely critical that we modify our holiday plans to reduce the spread of COVID-19 and to keep our friends, families, and communities healthy and safe. The CDC reminds us that the safest way to celebrate Thanksgiving is to celebrate it at home with the people that we live with. Traveling and gatherings with family and friends who do not live with us in our households increase the chances of getting or spreading COVID-19 or the flu. Staying home is the best way to protect yourself and others from COVID-19. Regarding testing, because of the consistent utilization in Goleta, we are adding an extra day of testing to the Goleta site. Beginning next week, we are adding testing availability on Tuesdays. With this new date, the Goleta site will be operating from Thursday to Tuesday, 7 a.m. to 7 p.m., and we are working to create limited number of same-day appointments. I anticipate more difficult days ahead as we grapple with the impact of rising cases in our community and all around the state. I'd like to conclude with this encouragement. Let us not grow weary in doing good, for in due season we shall reap if we do not give up. We all have many messages and lessons from our youth, from our faith, and from our culture that are helpful for us to draw on for encouragement when times are tough, like now. Do not give up, but fight the good fight. So please fight the COVID-19 fatigue. Continue to wear your mask, maintain at least 6 feet distancing from others, wash your hands, and please don't gather with those not from your household. Thank you for doing your part to keeping everyone safe.
Thank you, Dr. Renoso, for those important words. Nancy Anderson, the Santa Barbara County Assistant CEO, who is our Business Community Liaison, is here to share additional information on the county's collaborative work with local businesses.
Good afternoon. As indicated, the governor accelerated county movement to more restrictive tiers and tightened the time frame for counties to comply with the new tier restrictions from 72 to 48 hours. 41 counties representing jurisdictions and within 94% of the state's population resides are now in the most restrictive purple tier. The county had been in the Tier 2 red assignment since September 29th. The governor's change moved the county back to the purple tier on Monday. This significant change affects several sectors, including retail and shopping malls are restricted to 25% of indoor capacity. This is down from 50%. Museums, zoos, aquariums, movie theaters, places of worships, and gyms and fitness centers and restaurants are back to outdoor only. Wineries and bars are closed unless serving food as a meal under restaurant guidelines outdoors. Now with the announcement late yesterday of a limited stay-at-home order for counties in the purple tier, it is ordered that non-essential work movement gatherings must stop between 10 p.m. and 5 a.m. daily. This is effective this Saturday and running through December 21st. For restaurants, takeout is still allowed after 10 p.m., but no sit-down dining outside. Workers supporting groceries, pharmacies, convenience stores, and other retail that sells food and beverage products are considered essential workforce and would be able to remain open during the hours of 10 p.m. and 5 a.m. to provide for those essential services. It is important to note also that the County of Santa Barbara continues to hold by health officer order to no gatherings at this time, which is more restrictive than the state's current guidance on gatherings. The state's changes this week represent a significant step back and disappointment for industry sectors who have struggled for months to keep their businesses going. We want to thank our business community for their effort they are putting in to comply, making sure their employees and patrons are safe to limit the spread of the virus. We acknowledge the struggles of businesses having to adapt quickly to the varying rules, procedures, and directives issued over the past 9 months, and applaud the resiliency with which many have partnered in support of each other. There are nearly 4,300 businesses that have attested to reopening through the county's RISE process, or Reopening in Safe Environment, that was launched in May due to the pandemic. We will continue to keep businesses updated, and the latest direction from the state through the county's RISE process will be put on our website. The newest guidance and business information is available on our website at recoverysbc.org, and businesses with questions related to the new tier assignment or other operating questions may email the public health representatives at ehsadmin@sbcphd.org.
Thank you, Ms. Anderson. I'm very pleased that Dr. Lynn Fitzgibbons, Cottage Health's infectious disease specialist, is also here today to share her insights into the issues our local hospitals and medical community are currently facing.
Thank you, Supervisor Hart. As you are hearing today, and as we have seen over this past week, Santa Barbara County is clearly entering the next chapter of the COVID-19 pandemic. Our daily case rates have continued to climb in recent days and are now far higher than the rates from just 1 to 2 weeks ago, the rates that had led to us moving to purple. With this acceleration in case rates over the past week, we know to anticipate surges in hospitalizations and tragically in deaths in the weeks ahead. From our experience with this, it takes most people many days, often between 3 and 14, to first develop symptoms after they have been exposed to this virus. Over the first week of those symptoms, many people slowly continue to worsen, and some will eventually need to be hospitalized. Our experience with the virus so far tells us that up to 10 to 15% of people with this infection may need to be hospitalized. And for those patients who develop life-threatening illness and may tragically lose their lives to this disease, we know it will often be after another 1 to 3 weeks in the hospital. What does this mean to us today? I think it reminds us that we've seen our county's COVID hospitalizations climb over the past 2 weeks, and these are a result of infections that were spread several weeks ago. Similarly, when we hear about exposures or the several hundred new cases reported by our health department this week, we know it will likely be weeks until we truly feel that in the hospital or in our death rates. As concerning as the recent changes have been, we have to remember all the ways that this chapter looks different than our experience over the summer or back in March and April at the very beginning. We know so much more about this virus, about the ways it spreads, the ways to prevent its spread, the best ways to manage patients with mild illness or critically ill. Perhaps the most important difference at this stage of the pandemic in the hospitals is our ability to safely and effectively take care of patients with COVID-19 in parallel to continuing to safely care for all of the other health needs of our community. And we do this well. Thank you to the community for its ongoing diligence to fight the spread of this virus and keep one another safe. You are helping our hospitals and all of us remain ready to provide ongoing care. Finally, I'd like to remind us that communication and education are vitally important when our community faces hurdles and challenges of the magnitude we are seeing and indeed of the magnitude we anticipate. Comprehensive press conferences such as this, the frequent expert updates by our public health officials, Dr. Renoso, Dr. Henning-Ansorg, over these recent months have been critical to keep our public and the healthcare workers informed. This week, I'd also like to thank everyone who viewed a brief community update, which was posted on Wednesday, and to tell everyone that we're working on the Spanish translation for this information and looking forward to perhaps doing more community updates in the weeks ahead. I want to add a thank you to Supervisor Hart for his recognition of healthcare workers today. It has been a remarkably exhausting year, I think, for so many people in our community. And I think to take a moment to thank this week in particular healthcare workers and first responders, I just very much appreciate. I'd like to conclude with a reminder of the power we each have in dictating how this epidemic is going to play out in Santa Barbara County over the coming weeks. For the reasons I mentioned above, Thanksgiving week around the country will literally dictate the shape of December for every single community. In Santa Barbara County, I am confident we can regain control of our curve and would like to finish with, again, another thanks to every person this week struggling with the tough decisions about whether or not to see loved ones, whether or not to get together after what has been an exhausting and very challenging year. We have many reasons to be confident that Thanksgiving 2021 is going to look better. It's going to look different and it's going to be easier. But I just want to thank everybody for the decisions that they're making to keep our community safe and to make sure that as we enter December in our hospitals, we do so in the best possible way. Thank you. Thank you, Supervisor Hart.
Thank you very much, Dr. Fitzgibbons, for that empowering message. We'll now go to questions from the room. Ms. Lair?
I'd like to ask Dr. Renoso about enforcement and Dr. Fitzgibbons about what you say to some people that are, I'm seeing them online, just totally in denial with the fatigue, just, still going to go to grandfather's house or through the woods or whatever that saying is. Can I start with Dr. Del Renoso?
Sure. So I can tackle it, and Supervisor Hart can add to it. From the public health perspective, we in environmental health services we have sent out education and expectations to all the restaurants, the bars, and the businesses that we govern and we monitor and we regulate. And so I anticipate that after the education has been done, that we will also be very vigilant in monitoring whether those businesses are complying with the new state health officer order.
Yeah, and I just add, Tracy, that number one, this is a brand new order from the Public Health Department in Sacramento, and so we are working through communicating this message, as clearly and effectively as we possibly can. So that's the first thing. We want people to understand what it is that we're asking them to do. And yes, there will be enforcement. As Dr. Renoso mentioned, environmental health will be working directly with restaurants and other businesses that they regulate to ensure compliance. The code enforcement officers and all the local governments, are alerted about what this is now requiring and will be engaged as well. And law enforcement and the Sheriff's Department and the District Attorney are prepared to intercede if there are egregious violations. The county has new administrative fines that are available to help with enforcement, and this is a very serious matter, and we want people to comply voluntarily, but if they don't, we have consequences that can be levied.
And I very much appreciate all of that. I think that from a healthcare worker's perspective, I don't want to lose sight of the fact that through efforts like this, the efforts that have been put in place by our health officials, our healthcare workers through these last few months, the overwhelming momentum, the overwhelming surge through our community is that of an informed, well-intentioned community who is making sacrifice, who is perhaps sad about what's ahead in this next week, that it's not what they want it to look like, but are doing the right things. And so it's a little bit like floating in the ocean, and I think there are certainly smaller waves that we're so grateful to have such strong leadership to, I think, address when things are pointing in the right direction. Small groups or individuals are perhaps more vocally going against the grain. But I feel very fundamentally that in our community, we have a population that cares, is invested, is well-informed, and is doing it right. And I'll go so far as to say, I think it is because of the community's efforts, our health department's effort, our county's efforts, it's because of all that even though our numbers are going up, we're going up last. And we're going up last as all of our neighbors, our entire region has exploded. That is almost certainly, in large part, due to exactly this.
We'll now go to questions on the phone.
Yes, first up is Malia Martin with Santa Maria Sun.
Hi there. So first quick question, any update on the number of students infected from those 2 Halloween parties that happened in Santa Maria?
I can take that. No, other than the last reported 20 cases tied to the parties, we do not have additional numbers. However,
Okay.
I do want to share that we are seeing North County and Lompoc spiking up in outbreaks, in hotspots. And I want to say that our team, we're seeing that this is could be the effects of the parties that occurred over Halloween, the exposures to the immediate family members who then unknowingly expose their coworkers. So we're seeing the effects right now.
Thank you. And are there any other outbreaks of kind of a similar large size that the county is monitoring right now? And if so, what are those outbreaks associated with?
We are currently investigating 12 new outbreaks this week, and they are under investigation. 7 are in congregate settings, and 5 are business related.
Okay, thank you. Speaking of business, the unemployment rate from last month, according to data released, I think today, saw another solid decrease. But do you believe that now that we're back into the purple tier, might this result in an increase in the unemployment rate in months to come?
Yeah, unfortunately, I think there will be a significant impact on the local economy. The response to the threat As Dr. Fitzgibbons mentioned, I think people are going to take that very seriously and are going to constrain their activities, and that will have an effect on the business climate. I want to urge everyone who's approaching the holidays to please, use their shopping dollars locally. We don't need to be supporting the national online retailers with online shopping. We need to be supporting our local businesses, and that can be done safely, and carefully. But this is a very difficult time, obviously, economically.
Thank you.
Thank you, Malia. Next up is Josh Molina with Newshawk.
Yeah, I have a question about schools, and this question is for Dr. Fitzgibbons. The decision whether to reopen schools, both Santa Barbara Unified and Goleta, the two largest that have not opened yet, has to some degree been politicized, with people debating how bad COVID is versus how detrimental it could be for kids. What is your medical opinion on whether schools that have not opened yet should open? In some cases, like Goleta, 19-1, 5 days a week. What is your medical opinion on whether that should happen in January?
Thanks for the question. I'm not sure I'm qualified to comment on the final school board or superintendent's decisions regarding the specific districts, but I can certainly, I think, get to the root of your question, which is it safe for our kids to go back to school? And for the schools that are not yet back, should they continue to move in that direction, I think is perhaps the root of the question. What we know about this disease in children is that it seems to affect children in a less severe way than it does adults. There are lots of very interesting reasons that have been theorized about this. A recent one, just in the last few weeks, was actually related to the fact that children, over the course of a year or perhaps their young lives, are bumping into so many similar coronaviruses that maybe that's in some way protective. Or maybe it's something about a child's immune system, that most children that get this disease don't suffer such severe consequences. We can't have this conversation, though, without mentioning some of the life-threatening complications we've certainly seen in children. The Kawasaki disease-like syndrome that some, a tiny number, but still some children do suffer from, related to SARS-CoV-2 infection. All that being said, the decision to, I think, have a school occur in person is really balancing these health decisions against, of course, the critical nature of in-person education. And I think top of my priority list as a mom, not as a physician, but as a mom, is making sure my kids can be back in the classroom with their teachers and their peers. I think that to make a decision for what is definitely going to happen in January right now is somewhat impossible. The reality is this thing is moving so very fast that I don't think any of us, no matter how closely we follow this, know what January is going to look like in our community, or what decisions our superintendents and districts are actually going to have to face. But I think that, again, I think it's less important whether a school's gone back or was preparing to go back. And what's more fundamentally important is whatever the condition of the community is now in January, in March, making sure that everyone is, I think, observing safe practices, listening to our public health officials, and getting the children back, if possible. I can't emphasize that enough. So hopefully that answers some of your question.
Yes, and last question, what type of additional enforcement will we expect to see in light of the curfew order? Will we see, maybe this is for Supervisor Hart, will we see tickets in the Isla Vista? Will we see focused attention in areas where we know people are likely to congregate after 10 a.m.? What does that look like as a practical matter on the ground?
Well, I think as a practical matter, the conversations will begin with education. As I mentioned before, this is a brand new order. The governor's office and the Department of Public Health only issued this yesterday. So there is a learning curve. We need to explain what the new rules are and urge people to comply. We have been very successful over time in making that plea to the public to follow the directions from public health. And, I have no reason to believe that isn't going to be the case, but if we find, in time that that is not successful by itself, there are additional enforcement tools that will be deployed to try and get people to comply. Those that aren't going to cooperate, there are going to be consequences potentially.
So there's not likely to be tickets this weekend.
No, I don't. I won't prejudge interactions with people and the authorities, but the beginning of the conversation will be education.
Thank you, Josh. Next up is Tom Bolton with Newshawk.
Good evening. I have a follow-up question for Dr. Fitzgibbons about the hospitalization numbers. Clearly, they're rising, but notably, the number of people in ICU has not thus far risen. And I'm wondering what you would attribute that to. Is that simply the final lagging indicator, or is there something else in play? And I guess specifically, I'm wondering about the fact that more of the people getting infected now seem to be in the younger age groups.
I think it's a great question, and I think the answer is both. So just to, I think, repeat your two postulates, I do think that we are going to, with this next chapter, probably see a younger population in the hospital and around the community diagnosed with this disease. We already know that we are. And so with a younger population in the hospital, of course, there is less risk of severe critical illness, but the risk remains, I think, really for anyone in the hospital, that they could deteriorate over a matter of days and then end up, unfortunately, in an ICU level of care. I think your second suggestion, though, is certainly very true. I think it is a lagging indicator, and so I think what Mr. Bolton is indicating is this idea that if I'm exposed today, I become symptomatic in a median of perhaps 6 days, 5 or 6 days. It then takes me another week or 7 days for me to be sick enough to even enter the hospital. But for that first few days in the hospital, I'm unlikely to need ICU level care. Some people do go straight to the ICU, but often there's a period of time where people are not critically ill. They're not in an ICU yet. And yet, over a few days, they ultimately do worsen to a point that they need to be in the ICU. So I think it's probably both. It's probably a lagging indicator, and I think it's probably slightly reflective of, hopefully, a slightly different population with this chapter.
Okay, thank you. And then I had one other question, doubling back to the issue of schools, which you spoke to at length. But Dr. Fauci was quoted either yesterday or today as really saying that, getting kids and keeping kids in schools should be a very high priority. And I'm just wondering if you share that perspective, as a medical professional.
So as long-winded as I was before, I will answer that one with absolutely. I'm not an economist. I'm not a business leader. I'm just a physician and a community member and a parent. And I cannot think of something that I think matters more to us as a society, us as a community, than getting our children back in the classroom as safely as possible. I guess I ended up being more long-winded. I meant just absolutely.
All righty. Thank you very much.
Thank you,
Thank
Mr.
you,
Bolton.
Tom. And next, we're going to Fabiola Navarrete with Tu Tiempo Digital.
Yes, hello, good afternoon. Well, this question is for anyone who wants to answer it. Okay, this is about gatherings. I know that now businesses are being affected now again with these new restrictions, but we've heard that there are people who are still celebrating parties with more than 60 guests. So we want to know if this won't be a good time to start finding these people, because we know that these gatherings are causing a lot of the spread of this virus.
I can start. Yes, I absolutely agree with you. It is gatherings that is I would say, based upon our contact tracing data, we continue to see gatherings as a source of the spread. And so for large parties, there is a mechanism for community members to report such an occurrence anonymously, and our code enforcement team will be following up. But I want to pause and share that a lot of people are not realizing that a gathering really is when you get together with those outside your immediate household. So it could be 2 people, it could be 5 people. 2 weeks ago, I read notes that indicate a gathering of 5 good friends having lunch, and they all end up positive. This week, it was 6 people having dinner together. So we're talking about really all sizes of gathering, and really want to impress upon our community to not gather, not hang out, not have lunches, not get together, not have interactions, basically in a social setting, prolonged with those who are outside your household, because we're seeing that.
Okay, thank you so much. One more question. We've heard that in 2 states, there are some people who have been infected twice by COVID-19. Have you heard if here in Santa Barbara County, there is a case like that?
We've had small numbers of reports around the country, around the world, of people becoming reinfected in these last 10 months, 11 months. Here in Santa Barbara County, Dr. Ansorg and the infectious disease physicians, myself, Dr. Fisk, and others, whenever a case that is suspicious for a reinfection comes to our attention, we collaborate closely with Dr. Ansorg, and we work on trying to thoroughly investigate that. To my knowledge, at this point, there has not been a confirmed case of reinfection in Santa Barbara County. And to be clear, what I mean by that is a patient who was exposed to this virus, became well, got better, and then fell ill again with a new positive result, and that when we compared the actual virus, when we did what's called genomic sequencing of the first infection and the second infection that they had, confirmed that it was a different virus the second time around. So again, that has been clearly reported around the country, around the world, small number of reports, and we continue to look for it and be worried about it here, but we've not had such a case yet.
Okay, thank you very much. That's all.
Thank you, Fabiola. That concludes our question session.
Thank you for those excellent questions. The Board of Supervisors does not have a meeting next week, and there will not be a press conference because of the Thanksgiving holiday. The county's data dashboard will continue to be updated through Wednesday of next week and will resume daily posting of information on Monday, November 30th. In the event of breaking news, the Public Health Department will issue press releases, which will also be posted on the county's website. Looking ahead, the Board of Supervisors will hear a COVID-19 update from the Department of Public Health at the December 1st special board meeting. That meeting on the 1st begins at 1:30 p.m., and our next press conference will be on Friday, December 4th. Please continue to practice these 3 simple personal steps every day. Remember to wear a face covering and stay at least 6 feet away from other people. Wash your hands thoroughly and often, and don't touch your face and disinfect surfaces. Number 3, if you feel sick, stay home. Don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. Please find a new, safe way to celebrate Thanksgiving this year while looking out for the health and safety of your friends, families, and neighbors. This year, more than ever, we are stronger together, safely apart.